Hi there, everyone. Welcome to SCB TV Channel 182's new television show, The Dose, presented by Sweet Spot Smiles. The Dose is an engaging new health program that highlights top medical professionals and services in the community. We'll serve up a dose of information just for you. Let's get informed with Sweet Spot Smiles, Resurgence Orthopedics, 360 Med Spa, Sports and Spine Institute of McDonough, Southern Grace Hospice Care, McDonough Family Eye Care, HP Hyde Prosthetics and Orthodontics, Eagles Landing Diabetes and Endocrinology, Eagles Landing Family Practice, Eagles Landing OBGYN, Covenant Care Pediatrics, and Mercy Medical. Welcome to The Dose.
At Sports and Spine Institute of McDonough, we believe that sports and exercise are not only healthy, but encouraged to be part of your lifestyle. With repetitive motions and the overuse of muscles, you can obtain stiffness, soreness, strains, and possibly even injury.
The injury that I had was a strained back. I was always an athletic person, so when I came to Sports and Spine Institute, Dr. Patel gave me a personalized treatment.
Dr. Amrish Patel will not only give you a personalized treatment, he will also educate you on how to continue a healthy lifestyle so your body runs more fluently and more efficient.
So I'm in the process. My body's transforming right now, but listening to Dr. Patel, listening to the personalized care plan that he set out, I was able to strengthen the proper muscles to be able to perform how I wanted to.
Sports and Spine Institute of McDonough, where you will receive whole body care from a team ready to get you back in the game. Give us a call today at 678-866-3646 or check us out online at sportsandspineinstitute.com.
Covenant Care Pediatrics is passionate about providing comprehensive, safe, and effective care that is grounded in scientific research based on the latest guidelines, along with a dose of common sense. We provide innovative care from our breastfeeding practice to programs including newborn care, vaccines for pregnant moms, asthma, and many more. We are a medical home for children, coordinating all of their care, even when out of the office. Our advanced electronic record and patient portal allows us to provide amazing care for kids before, during, and after the visit, constantly tracking children's health. We keep busy parents up to date with our practice and the latest advances in keeping kids healthy both in print and online. Our ultimate goal is for every child in our practice and our community to reach his or her fullest potential. We spend as much time as necessary with parents and children answering questions and teaching about health, nutrition, and wellness. From short wait times to same-day appointments, we do everything we can to help busy parents. Come visit our new office at 245 Country Club Drive, Suite 200A, and visit our new breastfeeding center. Covenant Care means caring for your children as we do our own. That's our promise.
At Hyde Prosthetics, we're committed to providing personalized patient care. We believe that an open line of communication with our patients is essential to their success. From children to adult, Hyde Prosthetics works with all types of patients, providing below the knee, above the knee, and arm prosthetics.
Every time I come, it's always a smile, it's always joy, and it's always fixing my legs, and they're perfect.
With over 50 years of combined experience, Hyde Prosthetics strives to design a work of art that unifies technology, functions, and gives you the perfect fit. Striving to provide his patients with the best possible care, Todd Hyde can even make house calls. Hyde Prosthetics, the art of making a difference. Give us a call today at 770-892-0170.
On this segment of The Dose, we discuss local hospice care for your loved ones. The experts explain your options. Hi there, everyone. Welcome to The Dose. Of course, the brand new show here on SCB TV 182, where we highlight the health care in your backyard. I'm so excited and honored right now to be on location at Southern Grace Hospice, speaking to the one and only Chaplain Jim Weathers. Jim, what a pleasure to be with you today.
Thank you. It's my joy to be with y'all.
Now, many individuals know the name Southern Grace here in the community of Southern Crescent of Atlanta Metropolitan. What is the story behind this amazing organization?
Well, you know, we started only 3 years ago.
Oh, wow.
Actually, it was conceived in the heart of a nurse who saw that really patients were not necessarily the priority in all of the corporate hospice structures that she had worked in. And she felt impressed, you know, that the Lord was prompting her heart to start a hospice that was patient focused, that had patients as the priority, not a profit loss situation. And so as she began to draw this together, well, then she gathered around herself people who were like-minded. And then the underlying foundation that was laid for that fledgling start was in Galatians 6:2, where the scripture says, bear you one another's burdens and so fulfill the law of Christ. And we're very serious about that. That undergirds everything that we do.
Wow. And I know here, when individuals think of hospice care, they may say it's the patient, but here I know you explained it's the entire family, the entire village, right?
Absolutely. It's not enough for us to meet the needs of the patient, though the patient is priority, but meeting the needs of that family, because everyone in that family are in a bereavement situation, they're in a grief situation. All of them are experiencing loss in varying degrees. And so each one of those family members gets attention from Southern Grace. I mean, the 5 disciplines that we have, and you'll talk about that perhaps later, but the disciplines that we have are geared to meet the needs of everyone in that family.
I know you're with a team of chaplains here, and there's so much compassion that comes across.
There is. We've got a great group of chaplains. We have some varied background, you know, coming from different church denominations, but at the same time, all of our chaplains embrace what I call a pastoral mission.
Okay.
A lot of chaplains in hospice are more counselors than they are pastoral. Well, in Southern Grace, no. We've got great counselors. We have wonderful counselors. You're going to talk to some of our counselors before this is over. But while we are all capable to do counseling, that's not our mission. Our mission is a pastoral care for that patient and for that family.
And I'm now speaking with social worker Denise Bell at Southern Grace Hospice. Denise, talking about social work, there's so many different components to it. Explain.
We do a psychosocial assessment on the families that come to our attention here at Southern Grace, and we just want to make sure that they have the community support that they need. And we hook them up with community resources, whether it's, you know, food stamps, Medicaid, making sure that their bills are paid, and just looking at the holistic approach of the family to make sure that they are provided for during this time of transitioning with their families.
Yes, and with this time of transition, you explained that life still goes on. There's still bills that need to be paid and other concerns, and it's important that not just the patient, but the entire network family also, their concerns be addressed.
That is correct. We make sure that when we go into the home of the patient, or even in a facility at that point, even though the patient is our primary focus, we focus on the entire family. We are that additional layer of support that they need, and to make sure that they know that they have someone on the outside that are looking out for their best interest.
I see. And for that caretaker, such a huge responsibility, it's so important as well that they be able to express their concerns and questions. Why?
Well, because we have found out being a caretaker, that is a huge responsibility. It's a huge undertaking, and we make sure that we educate them on caregiver burnout. We make sure that we inform them that there are resources out there, such as volunteer services, additional caregiver resources in the home to make sure that they are provided for. And even us as the social workers, we will extend our visits to weekly, sometimes twice a week in the home, to make sure that they're getting that extra support that they need during the time that they are taking care of their loved one.
And I know here at Southern Grace Hospice, you all have a holistic approach, as you mentioned, but not just for those adult patients, also for those pediatric patients.
Yes, we do not only have the adult patients, but we do have pediatric patients as well. And with the pediatric patients, that's a huge undertaking, you know, with the babies taking place. And we make sure that they have those extra resources in place. And sometimes, you know, that is a little harder working with the pediatric patients. But we make sure that mom has the additional support that she needs, whether it's additional caregivers in the home, making sure that there are additional physicians on staff, and making sure that our nurses make not only daily visits, but they are making weekly and daily visits with those patients.
Well, we mentioned that it takes a team effort here at Southern Grace Hospice, and they're very proud of that. And I'm here now with the one and only Gloria Boyer. She is volunteer coordinator here at Southern Grace Hospice. I know you said it does take all hands on deck because your volunteers are critical.
Yes, they are. We love our volunteers. We consider our volunteers as a part of our team.
Awesome.
They're team members, and we love the work that they do, and just the little bit that they touch our patients' lives makes a big deal for our patients.
Wow. Amazing. And I know you said some actually go into the homes of your patients?
Yes, we have direct patient care volunteers and indirect patient volunteers. And our direct patient volunteers go into the home, whether it's in the personal home or in a nursing home.
Yes.
And goes and spends time with the patients and gives them comfort and just gives them a little bit of support at this time.
And I know you also have some that come into the office and help with some creative arts and crafts. And so explain what we're looking at right here.
For those volunteers who want to help in some way but aren't comfortable with visiting the patients in the home, we do have indirect patient care, which our volunteers can make our activity aprons that we have here for our Alzheimer's and dementia patients, where our patients need something to do with their hands. It gives them something to do and keeps them less agitated.
I love that.
We also have memory pillows that at the time of passing, the patients had some special clothing that the family really loved, so they give us two shirts of those, and we make pillows for our patients so they can have something for the family to remember by.
Very nice.
And then roses that once a patient passes, the nurses or the chaplains will put this rose on that patient's bed at the time of passing, just because it makes it a little bit special for the families.
I love that. Very special. I know you mentioned that your volunteers are available for your patients and also their network.
Yes, they are. Yeah, we go out into the community and we do different activities with the community, activities with the nursing homes, and do that for our patients. And we also have once a year our butterfly release program, which we put on a big memorial for our patients that have passed throughout that year, and just honor our families in that way.
Wow. And how important are the volunteers here at Southern Grace Hospice?
They are an integral part of our team, and we love them. And what's great is when we match a patient up with a volunteer and the lights of both of their faces light up just for that 1 hour a week or 2 hours a week that they may spend with that family.
I love that. And when we talk about hospice care, it is also important to make sure we're focusing on the relationship, emotional aspect of it, right?
Yes, it is. And the volunteers and the patients form a great relationship even after the passing. The families still have contact with that volunteer, and it really makes a big difference.
Such a beautiful experience. Thank you for watching The Dose. Stay tuned in because we talk diabetes and hormone replacement therapy with Eagles Landing Endocrinology and Diabetes Center. We have more information for you.
Compassion is at the very heart of Southern Grace Hospice. With the support of Southern Grace Hospice and its skilled staff, patients and families alike can focus on what's most important: enjoying life together and living as fully as possible. Coping with a life-limiting illness can be overwhelming. With the high-quality care and support provided by Southern Grace Hospice, patients and their families discover that end-of-life care includes hope, love, support, and dignity. Hospice services are covered by Medicare and most private insurance plans and include clinical, emotional, and spiritual services for both patients and families. Southern Grace Hospice, where your family is our family.
Health is the foundation for a life well lived. And no matter where we are on our health journey, our best health is discovered when we surround ourselves with people that empower us to be our best. At Eagles Landing Family Practice, our straightforward approach is redefining primary care by delivering premium health services that fit into the pace of your life. Our primary care physicians take the time to listen, to discover the root causes of the disease, and to walk with you on your health journey. Our in-house specialty services gives you peace of mind, so you can get the treatment you need when you need it. With multiple locations and extended hours, we provide the flexibility you need to receive primary care close to home, and then get back to enjoying your busy life. At Eagles Landing Family Practice, We want to be your partner in health, and we want to do that by providing better, more convenient primary care. Because we believe that when primary care is delivered with excellence, you and your family will be better served. Your lives will be improved, and the cost of health care will go down for everyone.
Are you still getting that puff of air when you go to the eye doctor? Are you still going through the side effects after having your eyes dilated? Get out of the dinosaur age. Come to McDonough Family Eye Care, where they have the latest technology to get the most thorough and comprehensive eye exam. That's the McDonough Family Eye Care, 1044 Avalon Parkway in McDonough.
You're watching The Dose. Remember to join us on Facebook at The Dose TV Show and visit our website for updates at www.thedosetvshow.com. Be sure to tell a friend. Hi there, everyone. Welcome to The Dose, presented by Sweet Spot Smiles. And of course, we put the spotlight on health and wellness because it matters to you. And right now, we're in your backyard with the one and only board-certified endocrinologist, Dr. Ronald Watts. He is with Eagles Landing Diabetes and Endocrinology Center. So excited to have you on. Diabetes, the D word, it is heavily talked about now that the rate of type 2 diabetes, as you know, has doubled in the last 10 years throughout the world. Why do so many people continue to be diagnosed and struggle with this very serious health condition?
Thanks for having me, Shana. I really appreciate being here and taking the time to explain some of your questions to the common medical problems in our community. But type 2 diabetes has been on an increase in the past several decades and is expected to increase over the next 2 decades, mainly because of the fact of the increasing rates of obesity in the United States.
Wow. I mean, I have to ask this, is that our diet, is it genetics, or perhaps the environment?
Well, it's a combination of mainly 2 things. Your genetic gives you the predisposition for diabetes. You may be predisposed to getting diabetes. But if you're not active, physically active, or if you're gaining weight and becoming even overweight or obese, you increase that risk for diabetes on top of your genetic predisposition.
Okay. So it's very serious business. We're talking about our health, putting the spotlight on diabetes and other wellness topics. For our audience at home right now, we hear the word type 2 diabetes, even type 1, but for type 2, which is more commonly diagnosed, what exactly is it and how does it impact the body?
So type 2 diabetes, as you said, is 90% of diabetics in the United States have type 2. That is adult onset, but sometimes even beginning in the teenage years.
I see.
In that case, the pancreas makes insulin to control your glucose. But imagine if you're making the insulin hormone, but it's not able to do the job of moving glucose from the blood into your muscle cells, into your fat cells. Because imagine the glucose just stayed in your blood, it's not going to do any good until it got into the cells of your body. Well, in type 2 diabetics, as they gain more weight, the insulin becomes not effective. We call it insulin resistance. It's not working at the cells. Therefore, they need, well, it can improve with diet to lose weight, can improve insulin resistance. Exercise can improve insulin resistance at the muscle cells, right? So the insulin works better. Or they may need medications, such as the oral medication or injections medications. Type 1 diabetics need insulin. The pancreas not making insulin usually begins in younger people, younger adults, even children. But in type 1 diabetes, it's not an insulin resistance problem, so that the body's not making insulin, they have to be treated with insulin. That's the difference.
Wow. Now, I want to make this very clear for people. If someone has type 2 diabetes, certainly there are medical options out there to be treated, that it's important for them to be compliant, but it's more than just saying there's a stamp of type 2 diabetes. They're at more risk for a stroke and heart attack, correct?
Correct. So having type 2 diabetes, the best way to control it, and we have patients who manage the type 2 diabetes and live to 80 years old, 90 years old with it well controlled. So it's not actually the diagnosis that causes the complications, it's how you manage the diagnosis. So if you had type 2 diabetes that's not properly controlled, you have increased risk of macrovascular, large vessel blood vessel disease, such as heart attacks, strokes, and peripheral artery disease, circulation problems in your feet, gangrene, etc. but you also have a risk for developing things that won't kill you,
okay,
but will make your life miserable. Would you say blindness?
Okay.
Right? Retinopathy is the most common cause of blindness in the United States, caused by diabetes. Kidney disease,
okay,
kidney failure requiring dialysis 3 days a week,
yes,
or dialysis at night, peritoneal is all complicated. Okay. And neuropathy in the feet. Now you would agree, neuropathy, pain and numbness in the feet,
yes,
kidney disease requiring dialysis, and eye disease, losing your sight, is not going to kill you, but it'll make your life pretty poor quality of life. Those things are more common, all of them, with poor control of diabetes. Diabetics should be aware of the A1C, their blood pressure and cholesterol for every visit with the doctor, and they should have that number when they leave, just like when you see your bank teller or you check online for your bank account, you know your bank balance.
Wow, so it's important to make sure we know our numbers and be compliant with that. Now, for someone that's had a diagnosis of type 2 diabetes, it's not the end of the world. I know you said that. You're saying, but there are viable treatment options and regimens that you and your team here at the practice can get them on to get them on a healthy lifestyle.
Correct. There are many different treatment options for type 2 diabetes now. There's been so many new drugs in the treatment of type 2 diabetes, but still the #1 best treatment is weight loss,
okay,
and exercise.
I see. That is very important. Now, of course, you being a board-certified endocrinologist, I know you treat a lot of type 2 diabetes and those patients that have type 1, but you also address the issues of hormones. And I've heard through a little birdie that when we're over the age of 40 years old, a lot of times our hormones can vary and change on us.
Correct. So what happens as we age is just a normal process of aging, and women go through a change where their cycles stop.
Yes.
Estrogen levels are going down.
Okay.
And they have the symptoms, hot flashes, night sweats, mood changes, irritability, yes, et cetera, et cetera. Well, that happens to women usually after 40, sometimes okay, in the early 40s, usually more commonly after age 50, all caused by estrogen deficiency. And it's kind of probably undertreated in women.
Okay.
But it's even more undiagnosed in men.
I see.
Men have decreasing testosterone levels even at early as age 40, but definitely after age 50, men are losing testosterone levels every year. So there's a lot of controversy about men with testosterone. That's a whole long story, but I advise you to talk to your endocrinologist okay, that's close to you about women replacing their hormone therapy if it's safe, right? Because if they have history of prior breast cancer, they can't do that.
I see.
And men for treating their testosterone deficiencies.
Wow, and you gave so many great options out there, and I think it's important to note that every patient is not alike, right? Just because it didn't work with one person doesn't mean it won't work with others, and that's why it's important to really collaborate and partner with your local endocrinologist.
Of course.
Wow. So any lasting words of wisdom for someone out there? They're saying, okay, Dr. Watts, I hear you. You did a great job explaining type 2 diabetes, even touched on type 1, and also hormone replacement therapy after 40 years old. Maybe they're 39, hovering on 40, and they want to be the healthiest they can be. Anything to get them on the road of success to help prevent any of the ailments?
Well, I mean, it's pretty simple.
Okay.
I mean, let's just keep it as simple as possible. And my first advice to anybody who's thinking about these symptoms or thinking about these complications, first know your results.
Okay. Important.
I see patients come from other offices and instead they were told the results were normal. What did they check? I'm not sure. They said they were normal.
Okay.
Well, I think patients should be more informed about what test was done and what was the number, not just it was normal. So patients should get informed and know the test that's done for female hormones,
yes,
or the diabetes, or testosterone hormone. You should know your results, and then once you know your results, you can decide if you are a candidate for therapy,
okay,
and then you have to discuss your therapy options with the local expert.
Wow, so be your own best advocate, right?
Right.
Because after all, it's your health. You're watching The Dose. We're aimed to keep you well. Stay with us. Regaining your health is easier than you think. At Eagles Landing Diabetes and Endocrinology, our physicians and friendly staff are committed to providing you with quality health care in a safe and efficient manner, providing treatment for diabetes, thyroid, hormone, and many other endocrine disorders. Our treatments for diabetes include continuous glucose monitoring systems, insulin pump therapy, and much more. Having issues with unbalanced hormones? example, Eagles Landing Diabetes and Endocrinology uses BioTE as a treatment for our patients. Eagles Landing Diabetes and Endocrinology uses top-of-the-line ultrasound equipment and is aggressive in providing treatment for our patients. All major insurance is accepted. Visit us today at 1050 Eagles Landing Parkway, Suite 302 in Stockbridge, Georgia, or call us at 770-389-9494.
At Eagles Landing OBGYN, we strive to create a warm and welcoming atmosphere. A place where women of all ages will be comfortable no matter what the reason for their visit. Eagles Landing OBGYN offers a full range of obstetric and gynecological services, all at one location. From FDA-approved 3D digital mammography, AIUM certified ultrasounds, bone density scans, urinary incontinence therapy, pelvic health therapy, lab services, infertility, pregnancy care, menopause treatment, fibroid treatment, bleeding problems, and yearly well woman visits. Our doctors specialize in minimally invasive surgeries, vaginal prolapse, and urogynecology, and much more. Our diverse group of physicians and friendly staff are sure to take care of your every need and more. At Eagles Landing OBGYN, we understand the importance of quality compassion care. Start the conversation today about your female healthcare needs. Call Eagles Landing OBGYN at 770-474-1919 to schedule an appointment. Visit our website at www.eagleslandingobgyn.com.
Found that I had breast cancer in 2004. The compression sleeve that I was wearing was not working. But when she fitted me, it's like a new person, you know, excellent quality. And like I said, I think I have made a friend for life.
Since 2008, Mercy Medical Supply and Mastectomy Boutique has been instrumental in helping breast cancer survivors feel confident and comfortable after surgery. When you walk through our doors, you will receive the personal attention and help that you deserve. Our goal is to offer you products that are not only fashionable, but also functional. Our services include bra, prosthetic, and lymphedema sleeve fittings. We also fit for diabetic and orthopedic shoes, compression hoses, and medical garments. Mercy Medical Supply and Mastectomy Boutique can help you find confidence, pride, and a sense of wholeness again.
You're watching The Dose. Remember to join us on Facebook at The Dose TV Show and visit our website for updates at www.thedosetvshow.com. Be sure to tell a friend. Hi there, everyone. We're putting the focus on your health. And of course, we can't talk about health without talking about lifestyle and weight management changes and fitness. And I'm so excited to be right now on air with the one and only, the Atlanta premier fitness couple. I'm talking about Daryl and Jackie Madison. Now, Jackie, of course, you are the lifestyle and weight management specialist. And I know you've shared with me that it is not just important to make sure we're eating portions that are healthy, also fresh food and having those snacks on us, but you've also shared that we've got to certainly add the physical fitness part. Why?
Right. It's very important because, again, when you're talking about lifestyle and weight management, in order for you to maintain like your weight management, exercise is key. Not only just for weight management, but it fights off all of these diseases that a lot of people will help minimize you know, in terms of disease. So physical activity is very important for weight management as well as your health.
Now, someone's watching us right now from their cubicle at work, and they're asking this real question. I hear you, Jackie, all right? I understand your husband's a physical fitness trainer, but they're saying, I do not have the time to do any of this. I have 1 to 3 kids, I'm working 1 to 3 jobs, I have hobbies, and I also have future goals. How do we incorporate any physical fitness into a very busy lifestyle, Daryl?
Well, certainly, that's very easy to do. If you want to do something, you can get it done. And I'm going to show you how to get it done very quickly and have a great workout. All you need is a chair and just start running in place. And speed it up every 15 seconds until you get to 1 minute. And then when you get to 1 minute, take a 15-second break, start back for 45 seconds, pick the pace up, and when you get to 45 seconds, slow it down, then do it one more time for 30 seconds. That gets your heart rate up, everything loose and going. After that, you can do jumping jacks using the same thing. Here, touch the hands at the top, take the legs out, do 1 minute of jumping jacks, take a little break, then 15-second break, 45 seconds.
Wow.
And then 30 seconds. After that, you know, you got to get the leg workout in. So just do some chair squats, up and down, for 1 minute and speed that up every 15 seconds, safely of course. Then after the minute, 45 seconds, then 30 seconds. You would have gotten a great cardio workout in, worked on your heart rate and all that good stuff in only about 5 to 6 minutes.
Wow. So, I mean, doing physical activities such as this can certainly help with weight loss, but I know what is so important, especially for those that have diabetes or diabetes running in their families, exercise can help with fasting blood sugar and also heart health, right? There also, it's no more excuses.
Right. I mean, if you want to get it done, there's certainly a way to do it. As I just showed you, you can do it in a few moments, or you can do it longer. But the most important thing is, to live a longer life for your family, just improve your health. You always want to just continue to exercise and get it done at the end of the day.
That is so important. And Jackie, I know when we talk about physical fitness, but you're saying it's a lifestyle. Don't just start it for the new year or just because it's summer to get those summer shapes that so many people desperately want. But you're saying keep with it long term because it helps us with longevity.
That is actually completely correct. And that is one of the things that if you actually plan this like you do everything else, and we always say this all the time. We make plans for the things that we want to do. We make that time to get it done. So again, Daryl has already shown you that it only takes less than what?
1 minute.
Yes. Exactly, to get it done. And if you do it in intervals, which is what he does, a lot of times you can get it in that way. So you're talking about 5 minutes throughout the day or 10 minutes on that lunch break. You can actually get it done.
We can actually get it done when we actually get to our health goals here and in the future. Thanks for watching.